I started having problems with my hip a couple of years ago. My hip would give out on me, and it just, after a while from walking, it would just be sore, and I couldn't, endurance, I just couldn't walk the way I used to walk, and I kind of had a glitch to it. And I broke my ankle in May, so I was kind of out of commission for a while, and it made it worse. It got to the point at work where I sit in front of a computer that sitting would hurt. And when I went up and down stairs, I would have to go 2 feet at a time. I couldn't go 1 foot, 1 foot, 1 foot like normal. I would have to go to brace myself with my other foot until this foot got down because I was worried it would give out or it just hurt. So it just took me a lot longer to navigate stairs and do a lot of the day-to-day bending or lifting objects. And it made my gardening hard to do, which I love to do. I also have a hobby doing jewelry, which I sit a lot, or I bend forward and back, and it got to the point where the hip hurt quite a bit. And I thought, well, it'll be okay, it'll be okay. And it got to the point where my quality of life was just not the way I wanted it to be. I had a new grandbaby. I just enjoy being outside. We do activities at the lake. There's just a lot of things that I want to do. And I just wanted to be able to do them again. I went to Longstreet Clinic. They took care of me when I had broken my ankle a couple of months earlier. A friend of mine recommended Dr. DeCook. He scheduled the surgery for me at Northeast Georgia. I went that day. Everybody was great. They explained everything to me. I had the surgery. I think I was done by 10 o'clock in the morning. They took me to my room after recovery. They had me up and walking by 3. He came to see me after, and he said he'd be in early in the morning, that if I would take so many steps that next morning that I could go home, which everybody was saying, oh, you're going to be there 2-3 days maybe. He came to me the next morning, and he always comes in with a smile, and which makes you feel good. He's not in a hurry. He takes the time. And he said, well, you will be discharged this afternoon. You just have to have your therapist come in and walk and do a couple of steps, and you'll be ready to go. And I was. The therapist came. We did walking down the hallway. We went up and down some steps, came back. I was home by 1:30 that afternoon. The next day, it was fantastic. You have all this fear about what is going to happen and how long recovery and how much pain, and this was nothing. It really wasn't as bad as when I broke my ankle. The physical therapist came. They were scheduled to come. We cut that in half. They said I was doing so great and that they had noticed such a difference in patients' recovery time with the anterior approach as opposed to the older posterior approach. I would do my exercises, come in, I do them with them. They'd say, oh, well, you can't do that because, oh, you can do that. You've had the, and they would forget because they're in this routine with the other procedure, and now with this anterior approach, you're just more mobile and you have no restrictions whatsoever. I started walking in the kitchen, moving around and just using the counters for stability, and then I'd forget sometimes and I'd be sitting and I'd just get up, and I just surprised myself that I would get up and just walk because there was no pain, and you don't think about what you had done and about it being major surgery. Well, I expected to go back part-time to work, but I went back full-time. I could sit, I went home, and it was very easy. I could get up right away and just walk. I don't have to hesitate. Gardening is bending and stooping. I hadn't done all that in probably a year, at the point where it hurt so bad and was so uncomfortable. And now I can go out and I can bend down and pick flowers. I can move the mulch. I can trim. I can just walk around the yard and enjoy what I've done in the yard. I can even dig holes with the shovel and stuff that I couldn't do before. I just have my balance back, and there's no pain. I'm a member of a Relay for Life team here in Hall County, and of course we walk. It's a 12-hour walk, and I used to be able to walk quite a few laps. And last year I could not walk. I had a hard time even walking the survivor lap because I am a breast cancer survivor, and it means a lot to me. And this year I plan to walk many laps.